You should have kept going. Come in.
Hello, how are you?
I'm doing good.
Hey, I'm Nurse Badgett and I'll be taking care of you today. What's your name?
Antoine Armstrong.
Okay, and your date of birth?
083192.
Okay, close curtains upon entry, wash my hands. So what brings you in today?
Head to toe assessment.
Okay, do you know what that is?
No, ma'am.
Okay, so basically a head to toe assessment is a physical exam. I'll be examining your head to your toes. And also, can you tell me where you are?
Shadow Health General Hospital.
Okay, and what's today's date?
April 24th, 2016.
Okay, so patient is alert and oriented ×3. Speech is adequate and comprehension is adequate. No stuttering or any other voice problems noted. So now I'll be assessing your scalp. I'm just feeling for any lumps or lesions. No lumps or lesions noted. Hair is intact, hair is soft. No dandruff noted, no excessive dryness or excessive oiliness. Okay, so now I'll palpate your temporal arteries. Okay, temporal arteries, 2+, equal and bilateral. I'll palpate your ears for any lumps or lesions. Okay, no lumps or lesions palpated, no lumps or lesions seen on inspection. Okay, so your eyebrows are full and intact. Eyelashes full and intact. Okay, close your eyes and look down for me. Okay, no lumps or lesions upon the eyelid. Okay, look up for me. Look straight ahead. Straight ahead. Okay, look at the wall. Look at the wall. And look right here. Okay. Conjunctiva is pink and moist. No excessive dryness noted. No redness. Sclera is white. Okay, so now just follow this and don't move your head. Okay, no nystagmus noted. Now I'm going to examine your nostrils. Okay, can you breathe in and out one of your nostrils? Okay, nares are competent. Okay, can you open your mouth for me? Oral mucosa is pink and moist. All teeth are intact. Soft palate is raised. Okay, can you stick your tongue out? Up, down, side, side. Okay, can you go like this? Smile for me. Frown. Okay, facial symmetry is intact. Okay, so now I'm going to check your carotid pulse, and I'm making sure that I'm not doing this at the same time on both sides of the neck because that can cause the patient to faint. Okay, carotid pulse is 2+, equal and bilateral. Also note that the ears are within a 10-degree angle of the corner of your eye. Your eyebrows extend to the corner of your eye as well. Okay, so now I'm going to palpate your lymph nodes. side. Head to the side. Okay, so lymph nodes are non-palpable. Gonna access your trachea. Put your head up for me. Okay, trachea is slightly movable and it is midline. Okay, so now I'm going to check for your thyroid gland. Okay, thyroid gland is non-palpable. Okay, so now basically I'm going to just palpate and just tell me if you feel any pain anywhere, okay? Put your arms up for me, straight up. Sit up for me. Okay, do you feel any pain anywhere?
No.
Okay, sit up. Okay, no thrills or hives noted. So now I'm gonna check your respirations in your back. Come over a little bit so you can see. Okay, breathe in and breathe out for me. Okay, scoot up a little bit for me. Deep breath in. And deep breath in. Okay, now I'm going to check for respirations. You can sit back. Check for respirations for your chest. And deep breath in. Deep breath in and out. Deep breath in and out. Okay, again. Okay. Deep breath in and out one last time. Okay. Now I'm going to check for your heart sounds. Just breathe normal. Okay, now I'm going to check for your apical pulse. I'm going to do this for a minute. Okay, apical pulse is 80. Now I'm going to check for any vascular sounds with the bell of the stethoscope. Just breathe normal. Okay, S1, S2 sounds are present, no abnormalities. Okay, so now I'm going to check for any vascular sounds with your carotid pulse. Can you hold your breath? Okay, now breathe. And hold your breath one more time. Okay, and breathe. No bruise noted. Okay, so basically now I'm going to feel for your joints and tell me if you feel any pain, okay? Okay, skin is warm to touch and appropriate for race. I want to check your radial pulses. Put your hands out like that for me. Okay, radial pulse is 2+, equal, and bilateral. Okay, so now we're going to do a hand grip test. So just grip my hand with each one of your fingers. Or I'm sorry, grip your hand with each one of my fingers. Okay, so now I'm going to check capillary refill on each one of your fingers. Okay, so capillary refill is less than 3 seconds. Okay, so now we're going to go over here on this couch so I can assess your abdomen. I'm going to lift your shirt up, is that okay? Now be checking your bowel sounds. Okay, bowel sounds are present in all 4 quadrants. Now I want to check for any vascular sounds with the bell of the stethoscope. so no bruise or abnormal sounds noted. Also, upon inspection, skin seems intact. I see no abrasions or any lesions, no pulsations, which can be a sign of an aneurysm. Okay, so now I'm going to lightly palpate your abdomen. Just tell me if you're feeling the pain, okay? Okay, so now I'm going to deeply palpate, and this might be slightly uncomfortable. Did you feel any pain? Okay, so now I'm going to shirt down. Now I'm going to check for jugular distension. Put your arms down here so I can see. Okay, I see slight pulsations but no jugular distension on this side. Okay, slight palpations but no jugular distension on this side as well. Get up now. Come back to the chair. Hey, step up for me. Okay, you can sit down. Okay, so your costovertebral angle is less than 90, and your anterior to lateral is 2 to 1. Okay, so now I'm going to check your joints in your lower region. No abrasions or lesions noted on your legs. Skin is warm to touch. No edema or arrhythmia noted. Tell me if this is painful. Okay, was any of that painful? Okay, now I'm gonna check your capillary field in your toes. Okay, capillary fill is less than 3 seconds. Your nail beds are pink and intact. Now I'm going to check your tibial pulse. And it's called the posterior tibialis, not the tibial pulse. Okay, both pulses are 2 plus, equal, and bilateral. Now we're going to check the dorsalis pedis pulse in your foot. equal and bilateral. Okay, now can you stand up? I'm gonna come over here. Right here. Okay, can you stand still and close your eyes? Okay, negative run burn test. That's a good thing. So now we're going to do some range of motion exercises. So just rotate your head. Okay, other way. Okay, front, back, side, side. Okay. Okay, extend them. Up, down, in, out. Okay, now we're gonna do lean forward. Okay, back, side, side. Okay, now the lower part, go out, back, side, side. Okay, extend, rotate your foot. Do the other. Okay, knees to chest, knees to chest. Okay, the round exercises were regular. You can sit right there. Oh, never mind. Sorry. Okay, so can you step back and walk towards me on your heels? Okay, walk back on your tippy toes. Well, no, turn around and walk back. And then come to me heel to toe in a straight line. No, in a straight line, like heel to your toe. Okay, have a seat. Okay, so tell me if you feel this.
Yes. Yes.
Okay, and tell me if this hurts. Well, actually, I have to lay down. So come over here. Okay, and scoot up a little bit. Relax your feet. I'm gonna flex the foot. And does that hurt? Okay, I'm gonna flex this foot. Does it hurt? Okay. And come back with me. You can have a seat. Okay, so your skin turgor is normal in your lower region. Skin turgor is normal in your upper region, your upper region as well. Okay, any questions?
No.
Well, that completes the head to toe assessment.